नमस्कार, मैं कृणाली वारजुरकर। आप देख रहे हैं इंडिया फैक्ट न्यूज़। आइए नजर डालते हैं आज की ताज़ा खबरों की ओर।
दुबई यूएई 20 नवंबर 2025 प्रसिद्ध फिजियोथेरेपिस्ट डॉक्टर समीरा गुप्ता द्वारा स्थापित मेडिकल टूरिज्म और वेलनेस प्लेटफॉर्म ग्लोमेड्स ने दुबई में आधिकारिक रूप से अपनी शुरुआत की।
Hi, a very good afternoon. I'm Dr. Sameera Gupta, and today I would like to talk about the fact that I've spent only 25 years and more in the healthcare industry, helping people with the aches and pains and the issues of weight gain. But I understood one thing, that the problem is just not in one place, it is globally. And the fact is that everyone who needs help, I'm happy to help them because I saw the gap in the markets. There are long waiting hours, long waiting for appointments, for surgeries, and even medical opinions. Worst of all, they are not sure about the diagnosis, least about the cost. So whether it's India, Dubai, or any part of the world, I'm happy to help people to understand their pain point, to understand their problem, and also give them the right fit as a doctor for their medical opinion, whether it's medical consultation or just surgical consultation. Whether it's London, Italy, Dubai, US, UK, we're always happy to help because I saw the gaps not only in the markets but also in the mindset of people. So it's very important to work on the mind of the person to make them understand how important it is to take the right medical opinion. And that is what it is. Thank you.
Yes, ma'am.
Hi, my name is Dr. Avanti Kumar Singh. I am a former ER physician and Ayurvedic practitioner in the United States. I've written 2 books. The latest book is The Longevity Formula, and my purpose really is to democratize health information, to make it more accessible to more people. Western medicine, through my training, I really saw that it was very generalized. It wasn't personalized enough. And Ayurveda is the healing tradition of my ancestors. It's very personalized. And it's actually the original personalized medicine. It's data-driven. And so really for me, the whole point of the work that I do is really to integrate Western medicine and Ayurveda, but also to democratize the information so that more people have access to this information. I've found too long and for over 25 years that I've been a physician that most people just don't understand how to take care of themselves. The information is also lacking for them. And so that's really my goal with my work.
नो डाउट आयुर्वेदिक का जैसे अभी आपने बात किया सबसे ओल्ड अगर देखा जाए तो आयुर्वेदिक ही है बट फ्यूचर क्या देखते हैं अभी आप जिस तरीके से आप कोलैब होके अभी दुबई पे हैं तो 2025-2026 में कैसे देखते हैं?
I would say that it's really about integrating Western medicine and Ayurveda, right? It's about bringing both of them together, and also showing the evidence, the data that we have, the research that we have that actually proves everything that we've been doing for 5,000 years in Ayurveda is actually scientifically valid and evidence-based. It's not just these practices that our, grandmothers and grandfathers have been doing for 5,000 years. That's important, but it's all based in science. It's all validated by science. I think that's the most important thing to keep in mind.
Yes, and that's exactly what the point is, that this is my doctor, my associate from the United States, where she is the one who has got knowledge. So people of this stature, the consultants of this stature, is where we are giving them a voice to go global, to cross borders, to make people understand what every part of the world, how we can help them.
Sameera, we would also like to ask you that what is the story behind the inception of GlobeMedz and what inspired you to start this beautiful journey together?
Yes, well, having parents who were ailing with ill health back in the days, I'm talking about 12 to 15 years ago, they had not enough knowledge. There wasn't enough awareness, I would say, about the health and what kind of options you could get. So losing them with ill health just brought me to help every young and old person, whether it's a 3-month-old or a 96-year-old. Today, whether it was COVID, back in the days, even now, I'm happy to help anyone, whether it's a surgical, spine surgery, knee replacement, or just an opinion, or just a lifestyle modification with which Dr. Avanti Kumar Singh is helping us from the United States. And we just make it very simple. We make it very organic in terms of authentic. We reach out to you or you can reach out to us in whatever best way possible.
Dr. Aditi, I have a question for you. As a part of GlobeMedz, what is your long-term vision for GlobeMedz for the next 5 years?
I mean, I think that it's really what Dr. Sameera Gupta just said, is to really provide more access to more people, right? It's really to match them, because so many patients are confused. I think that that's so much a part of my work, is that there's a lot of confusion. People don't understand how to access the care that they need. And so I think that's really what GlobeMedz is trying to do, is to really connect people and help patients. It's really advocacy for patients, right? Helping them understand what are their options, what are the best options for them, and then connecting, making those connections for them.
And do you have a family treatment packages for families?
Say it again.
Families.
Yes, of course, we have family treatment packages also. So in case if you're looking out for a particular treatment plan, you're looking at a particular timeline, you're looking at the mother and the daughter-in-law to get treated together. Yes, definitely we can give you twin sharing rooms, we can give you twin options of where they can go, what treatment they can do. We can give you a package in terms of whatever you want to. So if one person is wanting to go in IVF and the other person is wanting to go through an endoscopy, we kind of can club them together and we can take care of it, because I have only spent 28 years of my life in the medical industry. I'm qualified from, say, GS Medical, KEM Hospital, which is amongst the top in the country of India. And we have understood the pain points so well that every patient who comes to me, initially for physio, then weight management, and then eventually the family used to ask me, can you help me with Ayurvedic options? Can you help me with some consultant who can give me an orthopedic consultation? Or my mother is not able to walk, can you give me an orthopedic opinion? So I was not becoming the orthopedic. I would just give them or give her the right guidance for the treatment. Just connect them to the right doctor, and that is what it was.
अच्छा, जैसे डिफरेंट कंट्रीज से डिफरेंट लैंग्वेजेस होती हैं, जैसे चाइनीज होते हैं या जापानीज होते हैं, वो भाषा में इंग्लिश में भाषा में, तो उसके लिए आप क्या कैसे मैनेज करते हैं?
Yes, so of course there is Google translators, and now that we are taking this upwards and onwards, we are going to multiple countries. We've already got offers to kind of conduct the similar things there, where we have my collaborators in Uzbekistan, in Georgia, in Italy, and we are having translators for them, and we are very happy. Even our Arabic patients, we have translators that come to India, they come to Bombay, and even if they are here, they want to get treated here, we are happy to connect them to the doctors here, because I think even Dubai is booming with medical practice, and we are happy to just connect them to the right doctor. The geolocation is not mine, it is the patient's decision. Absolutely.
अभी तक का अगर रिकॉर्ड देखा जाए तो कितने केसेस आपने सक्सेस अपने पास से निकले?
Can you share some success story?
Yes, absolutely. So we had a patient that came in from UK, and she was wanting to do her IVF, and we got it done one out here. That she wanted to come because her family lives here, and she said, doc, for me, my mother, my family is here, so I would like to do it in Dubai. I know I would not like to talk about the name of the patient with the hospital name either right now. We are under strict, code of ethics. Medically, we cannot disclose that, but definitely we helped her. It was a success rate of the second cycle that we had in her IVF, and she was successful. Today, the baby is almost 3 years old. So, of course, we have been doing this, but these were all initially word of mouth. As my practice kept growing, my connections kept growing, we were doing it. The same thing happened in Mumbai. The same thing happened, I did one in UK. From UK, we moved the patient to US. So, it's all about the doctor and the patient compliance for sure.
मैम आखिरी चलते चलते कि आयुर्वेदिक से रिलेटेड क्या मैसेज रहेगा आपका?
Say it again.
आयुर्वेदिक से रिलेटेड क्या मैसेज रहेगा?
What
Any
message
message you would
give
like to
for
give in
Ayurveda?
terms of Ayurveda, how that is facilitating the healthcare in Dubai or other countries?
Well, I think again, it comes back to, it's an ancient healing science, 5,000 years old. It has so much wisdom in it. And I think that so many people, especially in India, have grown up with this as part of their everyday life. So understanding the power of Ayurveda, and it is very simple, not easy, but simple. And the practices have so much power to really, really alter our health. So I think just understanding that and really, really helping people understand that is really what I'm trying to do. And again, by democratizing the information, but also validating it with evidence, with research, with data, that is the key for us to move Ayurveda forward.
Yes, it has to be scientific. It has to be scientifically proven. We are medical practitioners. We believe in the fact that it is authenticity that what we believe in. We just don't want to give patients guidance without actually not understanding it. So we actually spend a lot of time studying it, understanding the science behind whatever we are gauging. So there are times that I cannot take on the case because वो patient जो इंदौर से था वो बॉम्बे आना चाहता था. I did not understand in the sense whether the diagnosis was even correct. So we had to actually re-send him for the diagnosis, even wherever he wanted to go. We gave him options of where to go. But patient इंदौर से था, एक भोपाल से था, एक ग्वालियर से था, which we brought to Mumbai. And it was just amazing. I sent one patient from Dubai to Mumbai, one patient from London came down to Dubai. So it's just a matter of what the patient is looking for. We are happy to help them anywhere, every time. That's all I can say.
फिलहाल अभी के लिए इतना ही। आपको आज की खबर कैसे लगी कमेंट में ज़रूर बताएं। यदि आप हमारे चैनल पर विज्ञापन देना चाहते हैं तो नीचे दिए गए ईमेल आईडी या कॉन्टैक्ट नंबर पर संपर्क कर सकते हैं। इंडिया फैक्ट न्यूज़ के साथ जुड़े रहने के लिए हमारे चैनल को लाइक और सब्सक्राइब करना न भूलें। अगली खबर तक के लिए फ़िलहाल मुझे दीजिए इजाज़त। धन्यवाद।